In this presentation, I'm gonna show how we can use machine learning and artificial intelligence to allow community health workers to navigate the patient through a very good healthcare system. So in this quick example, I'm gonna talk about the skin disease conditions, which is in very much prevalent in rural India. And what happens that people suffer a lot and they don't seek treatment on time, which impact their health. So let me just walk through what I'm referring to. So in present situation, like most of the family members are not aware about what disease condition, skin disease condition they have because of the contaminated water, waterborne diseases, and many things. So what happened? Their awareness level is not much. That cause a delay in seeking treatment. This and also when they feel that it's impacting the disease condition is impacting their everyday life, they go to the medical profession, for example health sub center or primary health center, and then they go to district hospital. So they go through different, 3 4 different kind of health facility, which significantly cost their money, time, and energy and effort. And also it's affect their mental health because they feel stress sometimes navigating through different health system. And sometimes when they feel that okay, this treatment is getting better, but they drop out of the system, they don't follow a particular protocol, or they do not um, seek the treatment for long term, which affect their overall treatment process. So, what I'm proposing here through machine learning and computer science or data science is that if we can allow or build a tool for ANM or Anganwadi workers, even ASHA, to identify the disease condition using mobile applications, so that they can, let's say, assume there is a situation, there is a disease condition. One patient has some skin disorder, and the family member are not sure what it is. They go to ASHA and say, okay, I have this disease condition, I don't know what it is. Even ASHA, we cannot expect ASHA or ANM to be trained on all the aspect. So they can, I'm proposing, or what I'm thinking, that if we give a mobile app to ANM or ASHA, and they can just take a picture of the skin area which is affected by the problem, and then the image will be processed in cloud somewhere using algorithm and machine learning program, which we have trained. And then it will give them ASHA a notification. Okay, this is that the skin condition looks like, for example, 90% of the chances of eczema, or 80% chances of measles, for example. So in that process, it will allow a patient as well as the community health worker to direct this patient to right or appropriate health facility. For example, if this is the case of measles, they can directly go to the nearby public health facility. Maybe a primary health center can provide treatment. But if it is a cancer, the primary health center might not have all the support and facility to help them. So they have to go to the district hospital or higher facility, even a specialty of a medical college. Doctor can train or diagnose her better. So also it will allow her to explain the disease condition, and allow worker to follow up with the patient whether they went for the particular treatment or not. And it will also help our system to reduce burden in lower on health system through directing patient to appropriate health facility. Yeah, so in this example, I'll show you how machine learning can predict a particular disease condition using an image. So I'm using, in this example, I will be using five skin disease condition: measles, cirrhosis, cold sore, eczema, and skin cancer. I have image downloaded all the images from the website, from Google, basically, and I downloaded it. And when I was downloading the images, so most of the images seems to have a kind of similar category. For example, for measles, all the images I have downloaded, which pop up in the image, the measles search, all the images for cold sore I downloaded when I search cold sore on Google. But there's one limitation. So whatever the images I downloaded was classified by somebody who may or may not be medical professional, and people have different interpretation. So the model which I'm building is based just an example to show how it works rather than accuracy. Like if we have more accurate image and more accurate disease condition, then the prediction will be very very high. And as I said, I'm using the online machine learning program to illustrate this solution. So what I'm expecting that it will save time to patient and help them to get, reduce this economic loss, and it will reduce the burden on the health system as well. So let's directly get into the example and show how I did it. Okay, so here you go. So this is the images I am using at the moment. What I'm doing, I'm using a custom Vision AI app which is developed by Microsoft. And then these are the I have. If you see in the left side here, this side, I have used different disease conditions. For example, so all the images I have downloaded is from Google. I have uploaded the image on cloud and through some AI system. You have to go through a bunch of settings, and also these are the disease condition for cancer. This is the disease cancer for cold sore. And then if you scroll down, you see these are the measles, examples of measles. And then yeah, I think, yeah. And then if you there are some other images of measles, eczema, cirrhosis. So I have uploaded all the images to the system and already classified each images. For example, these are the condition for, if you see, if these are the condition for eczema, and this is the condition for cirrhosis. So you can see how this image has been categorized as cirrhosis. You can have multiple uh, uh, tags as well for system to predict. I didn't do that. For example, this is another example which can illustrate this is a case of eczema. So I'm not sure how 100% accurate it is because I downloaded it from the web. So it's just to illustrate my point here. Um, this is another also classified as cirrhosis. This the image of the children is classified as measles. So you can see the different quality of images, the megapixel, and also still, and this is also classified as this image is also classified as measles. Um, I'll show you some more so that you can understand what I have done. Okay, these are the images which I downloaded from website and was classified as a skin cancer on the website. There are plenty of different types of skin cancer. So I don't want to get into that detail, but just to illustrate point, these are the images from the web, and I have manually classified them and given the a particular tag. So now what I have done, so now we are going to train the system. The system is going to train itself, and will give you a prediction what it to learn the pattern, the images. Okay, so because I already have did it, so I'm gonna download one more image so that system can predict. So I'm just gonna add, because it give an error earlier here that yeah. So when I was training it, it just gave you the error that there's nothing changed. So since system has already, if you see that nothing has been changed since previous training. So now I'm gonna add some more images to just yeah. I'm just gonna add some more images to. Okay, so let's add this image. It's from American Screen Society. Save images. Okay, so I already have save everywhere. So I'm just gonna put in community folder so that it will be easy for us, easy for me to identify the location. So here you go. So now I'm just gonna click add images, and it was in the community folder. I select this image, I uploaded it, and I'm just gonna give the tag as skin cancer. Here you go, and upload the file. So similar way I uploaded all these images earlier. So it's uploading now, it's successful, and now we are going to train the model. So now I'm going to do the fast training, but there are a bunch of options like advanced. If you click advanced options, you can see, the training budget, all those things, it costs money. So I'm just going to do the fast training. So the model is running in background. The computer is understanding the each images, their to see the image quality, the the color, the tone, the texture, the spread of the disease. Like for example, eczema is spread in a kind of larger area, where the measles has small dots, kind of yeah, small dots. So computer has processed that image in detail, and then it has learned a particular, it has developed an understanding that what I'm calling it eczema, and what I'm calling it skin disease, skin cancer. So now our system is already trained. So I'm just going to dive and select any of the images from the website and see what it says. So this is one example, one image. So what I'm going to do is I'm going to quick test how it has learned and whether it's predicting right thing or not. So now what I'm going to do, I'm going to add some URL from the website. I'm going to add some images from the website and see how accurate it's predicting. So this is, I'm just copying the image address here, and then URL, and then paste, and then let's see. It's processing now. Okay, now it has given the prediction. So here, if you see probability, so it has predicted 99.98% there is chances of cancer, and there's a 1% chances of cirrhosis. So it is spread in percentage, kind of to give you a kind of confidence level, So it might be. So we'll go to another example here to see if it predict. For example, let's say this one. I'm just gonna copy the image address and then paste it here and see what it says. You can see the different image tones, and so here you go. Okay, it's also predicting 99% chances of cancer. You see how the images, new images which we are feeding into the system, is being categorized by the system itself with some sort of percentage. Let's go to the another one. What about this one? Let's see what these images, how these images is being classified. So here you go. I'm going to add here. So if you see, okay, again, you see, It's give you a probability and say it's 100% skin cancer. Okay. Let's do some sort of measles. Okay, let's say uh, measles for example. Let's do the okay this okay. Let's do okay skin disease. Okay, let's say I have skin disease here. Okay, let's see how this is being classified. Okay, so it seems to me eczema to me, but we'll see what uh, computer is giving us classification. So um, okay, it's downloading. Okay, here you go. So for example, this is acne because we have not trained the system on acne. We have trained the system on cold sore. Let's see how cold sore is. Oh, so it's I think it's embedded somewhere. Okay, okay, it's okay. This website is a bit rubbish, I think. Yeah, okay. Just let's move to the another website. Um, okay, let's see this one. What? Okay, so copy the image address, and we're gonna put here in the system and see what it predict. Now it's running. So it's predicting 86% of the chances of eczema and 6.9% of. Okay, so you see the spread. You know, of course, the quality and all those things. Okay, let's try one more. Okay, okay, let's try this one. So it seems to like measles or chickenpox to me. And let's see what it says. Okay, now the system is processing it. It has given the probability of 99% chances of measles. So you see how we can use images of skin to detect what kind of images, what kind of disease condition it has. And if we give such a tool to ANM or ASHA, then it will help them to understand, the disease condition, and probably it will help the patient to go through, go at the appropriate health facility level. That will reduce the time, money, energy, and the burden on health system through directing them at the appropriate healthcare facility. So to illustrate my point that it's safe, the potential result of such application would be saving time, helping patients to get treatment early on, providing empowering ASHA and ANM, in a public health system, and also utilizing their time and effort. Yeah, so I think there are a lot of potential and advantage of machine learning applications in healthcare. And you can also think about the potential benefit in agriculture field or agriculture sector, that if the farmers can use this technology to understand the disease and crop related problems, easily they can find a solution. We can use that the same machine learning principle and apply in agriculture setting and help farmers to detect the diseases of the crops, and provide them potential solution what they should do if they have one two three kind of crops problem. So there are a lot of advantage of this machine learning image detection technology in variety on range, where we just need a visual inspection to get initial understanding. I'm not saying that it should replace the doctor or medical treatment, but the point is we can use the system to get initial idea. Okay, thank you so much. I hope you learned this something new today, and I'll provide some more detail later on. Yeah, thank you.